And if interpreters can start recording your rooms too, please locally. Thank you.
Are we still waiting, or?
I let them know many were coming back in, so we can get started.
Okay, thank you. Ralph, we're live streaming, right?
Yes, we are.
All right. Well, good evening, everyone. Thank you for joining us here today as we start to think through what reopening for the 21-22 academic school year will look like. Before we go into details about the work ahead, I want to take a moment to allow the members of the panel to introduce themselves, the roles that they play either for the district or for the city at large, so that you have a sense of who's in the room and who will be supporting the conversation this evening. So Ralph, do you want to lead the way?
Sure. Welcome, everybody. My name is Ralph Alenzisi. I'm the Assistant Superintendent of Digital Learning and Innovation for the Norwalk Public Schools.
My name is Alyssa. Oh, go ahead.
Good
Go
evening,
ahead.
everybody. My name is Sandra Fayowes, and I'm the Assistant Superintendent of Business and Operations.
Good evening, everyone. I'm Rob Pennington. I'm the Assistant Superintendent of Schools.
And good evening, I'm Brenda Wilcox-Williams. I'm Chief of Staff and Communications Officer for the district.
And I'm Tom Hamilton, Chief Financial Officer for the district.
Missy?
Good evening, all. I'm Norman Weinberger. I'm the school medical advisor.
Hi, my name is Miss Sierra Topoulos, and I'm the district-wide float nurse, as well as the person who does the contact tracing.
I'm Teresa Argandesi, the Assistant Director of Health for the Norwalk Health Department.
Brian Weeks, I'm the epidemiologist at the Norwalk Health Department.
I'd like to give a moment for the members of the board to introduce themselves as well.
Good evening, everyone. My name is Colin Hostin, current chair of the Board of Education here in Norwalk.
I'm Mike Parvis, and I'm a member of the Board of Ed representing the west side of town known as District E.
Hi, I'm Suzanne Korshutz. I'm a member of the Board of Education.
Erica DePalma, Board of Education, District D.
And Diana, I didn't hear your audio. I don't know if you again. Not coming
Better?
through. There we go.
Okay. Diana Carpio, Vice Chair, Board of Education, District C.
Wonderful. Did we miss anyone, or is that everyone? I think that's everyone. Well, thank you, members of the panel and members of the school community, parents, students, staff, and other guests that are here today to obtain an update of our reopening plan, where we are with the work, and what the work ahead looks like. As you may imagine, a year from now, we didn't expect to be having this conversation again in terms of setting up parameters to ensure that we continue to ensure the safety and well-being of our students as we continue to plan forward in accelerating their learning, given some of the challenges that we faced these past 16 plus months as a result of the pandemic, but also thinking about ensuring the safety and well-being of our students as we continue to move forward within the current pandemic that we continue to engage in. As you probably heard at 4 o'clock today, the governor made a number of announcements that kind of set the stage to some of the parameters that we have to have in place in September as we engage in reopening. As you know, under the initial order, we were required to have masks in school. And based on the 4 o'clock announcement today, that is a mandate that will continue to be in place for this upcoming academic school year. In addition to that, there are certain vaccination parameters that have been set that we are working to developing a plan to ensure that we have the necessary structures in place to bring forward those expectations. One of which is an expectation that our staff is vaccinated, and in circumstances that they are not, that they undergo weekly PCR testing to continue to monitor and ensure the safety of our students. As articulated earlier, the mask mandate remains, and members of the team will speak in greater detail about these components. I know that many of you have raised a number of questions that will be answered throughout this presentation today. So I'm going to ask that you hold your questions to the end of the presentation, where we will provide a few minutes for members of the public to pose their questions, and then we will engage in a Q&A. And I'm asking for this to be done so that we don't engage in a repetitive process where questions that will be answered in the presentation won't start populating in our Q&A box. So again, thank you for being here today. I'm going to turn it over now to Brenda that will start the conversation and some of the work that we've done to collect data from you to get a sense of what are the things that you see as important for us to address as we plan forward for this year.
Good evening, everyone. Ralph, if you can advance the slide to the thought exchange question. So we were very pleased, the next one, Ralph. We were very pleased that everybody engaged in one of our new platforms that we put in place to facilitate discussions with all of our audiences. And we used Thought Exchange as a way to ask for your input about what the discussion should be tonight. What are the themes, what are the questions and topics that we need to make sure that we were addressing? So last week, we put out a question to you as we plan for the upcoming school year. What are the most important things our district needs to think about to support all students? And we got a tremendous response. We had over 1,400 participants in multiple languages, shared over 2,000 different thoughts, and about 42,000 different ratings were given to those thoughts as you all had a conversation out there about this topic. So thank you for that participation. We will be refining this tool as we move forward, but we think it's going to be a really valuable way to have discussions with you and hear your thoughts, both parents, staff, and students as well. We had a number of students respond, and we had people respond in multiple languages. So we appreciate your feedback as we got ready for tonight. Ralph, next slide, please. So these were, this is just a visual representation of what your top responses were. We saw that obviously communication is a key issue here, and that is part of why we are doing this tonight. We were at the point where we had the information that we needed, that we felt that we were at a point where we could communicate more clearly with you as to what was going to be our situation and our plans for the upcoming school year. You'll see, can you back up a little, Ralph? You'll see emotional is a key word up here on the word cloud as well. Mental and emotional and health were something that is really important to everyone. And so we've added that to the presentation tonight, and we'll be talking a little bit more about the social emotional learning that will be in place to support your students throughout the school year as well. So again, thank you for helping provide the direction that we take tonight in terms of what we're going to be talking about. And now I'm going to turn it over to Brian Weeks from the City of Norwalk Department of Health.
Hi, everybody. So this is Brian over at the Norwalk Health Department. What you're seeing right here is just like a quick situational awareness update in regards to COVID. So where we are as a country as well as a city. So this is going to be very quick. But nonetheless, what you're seeing on the left-hand side here is the county levels of transmission, community levels of transmission from the CDC. This is looking at it from the last 7 days. These are essentially case rates, also coupled with positivity rates, just to figure out where everybody is with a certain threshold established. So as you can see, majority of the counties in the country are in the red. Looking specifically at Connecticut, which is on the upper part there of that map, you can see how 5 out of the 8 counties are in the red, the highest category you can be in. Fairfield County was in orange just a couple of days ago, but now it has switched. So the 3 largest counties in the state, New Haven, Hartford, and Fairfield counties are all in the high right now. If you look on the right-hand side, you'll see from the state health department, Connecticut town, city COVID-19 case rates per 100,000 of the population. What you're seeing in the more colorful map for most recent, August 1st to the 14th, just came out from the state just like an hour ago. You can see how Norwalk's at 14.1 cases per 100,000. The threshold to enter the high is at 15. So again, this is looking at it from a city and town perspective. So we're just on the cusp of it. But as you can see, majority of Fairfield County, especially the larger cities like Bridgeport and Stamford, have entered the red, as well as New Haven and Hartford have been in the red. And so definitely when you look below at the other map, about just only a month ago, mid-June, you can see how we were all below 5 cases per 100,000 except for 2 towns. And it was only in the yellow, which is, a very low category compared to obviously being in the red. So really emphasizing the point, things have changed dramatically, as well as, it's not something just centralized to Norwalk. It's relative to the state as well as the country. Next slide, please. So now when you see in the next slide, you're seeing basically the case totals by week for the entirety of the pandemic here in the upper left, the purple columns or bar chart. What you're seeing here is, and what I'm emphasizing with that red box there, is the beginning of September 2020. So we're using this as a reference point, given that there's limited data in terms of COVID. We haven't gone multiple years with it. And you can see how it dramatically changes near the end of September and entering October. And this is obviously a multitude of factors, the cooler weather, so less social distancing opportunities. It's also the beginning of school and people's normal kind of annual routines kind of kicking into place. They're not at, traveling, they're coming back from their seasonal homes or coming back to their seasonal jobs, and also children going back to school. So it's really important to emphasize this is a pivotal moment in terms of mitigating the opportunity for the exponential growth of transmission that we're seeing even right now in the summertime, but going into the normal kind of calendar year for, for schools and things of that nature. Below it, what you're seeing is another bar chart. This is relative to the Connecticut counties, all 8 counties, and COVID-associated hospitalizations. So this is looking at data from the day before. But what you can see, and again, the red box is kind of honing in on what's really the emphasis here. July, we were only at 25 total COVID-associated hospitalizations for the whole state, just at 25. What we've just entered, and the newer data from the state just got released an hour ago, we're at 344. And you can see how the essentially the curve here is very steep. It's almost mirroring kind of the curve we had with descending out of April into May. So it's kind of the reverse of that. We don't want that. But naturally, this is what we're dealing with, statewide in terms of the number of hospitalizations. And, Fairfield County is no exception to it, along with New Haven and Hartford counties having the most cases. Looking at the city itself, just with the recent data, we're almost at 12,000 cases through the entirety of the pandemic, with a total of 227 deaths now. So based upon the prior data that we have from the state health department, that's an increase of 2 deaths recently. So that's also pivotal data because we've been holding stable for a while at 225, but now it's moved to 227. In addition to that, looking at who's kind of the usual suspects, looking at age groupings by decade of age, you have 20 to 29-year-old age group at 23%, the majority or majority proportion of cases. And then you have 19%, 30 to 39. So this is a younger, more sociable group that's more mobile. Along with, obviously, you have 11.4% for 0 to 9, 10 to 19, kind of a similar percentage, 11% for 40 to 49, 50 to 59 to 10. So you're seeing a wide distribution in terms of COVID transmission. And, especially when we look at the school side, it's really important to emphasize, the 10 to 19 and 0 to 9, you got a decent proportion there too. And they're about to go back to school. So the hope is that everybody's fully vaccinated that can be vaccinated, really to mitigate that opportunity for transmission. Next slide, please. So again, this is just a very quick overview on what's going on in the city. We obviously cover a lot more data and information And we want to make this readily available for everybody in the community. So definitely check it out. We have 3 different ways you can check it out. There's the actual city webpage. There's social media such as Twitter and Facebook. Look this document up. We update it every week, and it shows vaccination data, case data, relative just not only the city, but also state and some of the country too. Just keeping things in focus and really showing the gravity of the situation we're dealing with the Delta variant really driving a lot of this transmission and changing the game for everybody. Obviously not great news, but we're doing our best to mitigate it. And, everybody's been doing an excellent job in terms of really participating, providing their input, as well as really taking the wheel by the hand. So really appreciate it. Thank you again.
Thank you so much, Brian. Good evening, everyone. Ralph, will you advance to the next slide? I'm going to be taking us through what Norwalk's efforts are going to be to make sure that we keep our students in-person learning. And we are going to be continuing some of the mitigating efforts that we had put in place at reopening last year and some that we ended with in the spring. And then I'll take you through some new strategies that we will be putting in place. Again, masks will be required by all while inside the schools. And we are continuing with the 3 feet social distancing when feasible, making sure that we can fit all of our students back for in-person learning. While outdoors, there are no masks required as of now, but of course, this can change depending on the community transmission. We are continuing with isolation rooms in every school and really having frequent hand washing as an additional strategy, especially after recess, after gym, and before eating. Next slide, Ralph. We're also updating some aspects of the plan. We're having masks while students are being transported in our buses. We are going to have students assigned by section. So if you walk into the bus first, you are assigned to the rear of the bus, and we will be communicating this to parents. There's nightly sanitation for our school buses, and we're continuing with Zonar that allows us to see who got on the bus, when, and where they're getting off. And also quick access to bus videos in case we ever need to refer to those videos. Lockers are going to be in use this year. That is new for our kids. We are working with school principals to make sure that lockers are not being assigned to cohorts alike so that we don't have bunches of students in the same row of lockers. So decreasing that density around the lockers is a mitigating strategy. Cafeterias are also in use, and we've also decreased the density by adding additional lunch waves, by continuing with multiple stations when possible. And each school actually has their unique cafeteria plan and lunch and breakfast plan, although most breakfast is grab and go and eaten in the classrooms. And we are going to make sure that sanitizing hands and having the capacity to wash hands is a strategy that all schools will be able to take advantage of. Next slide. We've also made sure that we are inspecting and making sure that all our MERV 10, MERV 13, and HEPA filters are operational. We've changed out the filters according to the guidance. We're keeping the windows open for ventilation and telling staff that fans cannot be in use unless they're being used to exhaust, meaning that they're blowing away from folks to exhaust whatever air is in the room. So we're continuing with those mitigating efforts. Next slide, Ralph. Additionally, we're maintaining a rigorous standard for sanitation, which was established last year. And although the CDC this year has loosened some of the sanitation requirements, we have not. We will continue to do deep cleaning in locations where positive cases are reported, as well as the nightly cleaning and spot cleaning that we started last year. We are using a new multi-surface cleaner that has been recommended by the CDC, and ensuring that all classrooms are outfitted with this cleaning supply. Ralph? Thank you. As of now, we are limiting visitors to our schools. We're limiting visitors unless they are in service to the school. These are our service providers, as well as anyone that is in service to the student. However, according to the governor's recent press release, these service providers are going to be also having to follow the guidance that was put out as far as vaccination and testing. Volunteers are currently on hold, and so are gatherings. So right now we're not allowing for social gatherings because of the transmission rate, and we're limiting the density of in-person meetings. So making sure that there are spacing between folks and that people are following the guidelines for wearing masks and the other precautions that we're taking. Ralph? Thank you. I'm going to turn it over to Missy now, who's going to be taking us through the next several slides. Missy?
Hi, thank you, Sandra.
Thank you.
When it comes to a response to a positive case, a case report form will be completed for every student who has a laboratory confirmed positive COVID-19 test. That form's provided by the Norwalk Health Department, and upon completion, we send that to the Norwalk Health Department, begin contact tracing. We can get reports and emailed positive reports from the lab, as well as we have a state website that also lets us know of the positive cases. Any student or staff who appears to have symptoms that possibly could be COVID will be instructed to contact their primary medical doctor for evaluation. Next slide, please. We continue when sick. We continue to emphasize the importance of staying home when sick for both staff and students. Anyone who have symptoms of an infectious illness that you think maybe is the flu, it could be COVID, please stay home and seek testing and care from your medical provider, regardless of your vaccination status. We are aware people who are vaccinated are also contracting COVID. So please seek out medical attention. Students who present with any symptoms will be sent home. We are doing the same as of right now. Addendum 5 has not come out from the state, so those policies are still in place that everyone experienced last year. So stomach aches, headaches, these are all symptoms of COVID. So we follow the Addendum 5 that's still current. Next slide, please. For contact tracing and quarantine, all fully vaccinated persons are exempt from quarantine if exposed to a COVID positive person, as long as they remain asymptomatic. So fully vaccinated means 2 shots from the Pfizer or Moderna and 1 shot from the Johnson & Johnson. It is 14 days after your last dose that you will be considered fully vaccinated. So for parents, if your children have been vaccinated, please submit those dates to your school nurse, because that we put that in our nursing program, and that will help us also. Someone who previously tested positive for COVID, they still only have 90 days from that, either the start of the symptoms or that positive test result, and is asymptomatic, so they don't need to quarantine, but it's only the 90 days. Sandra, do you want me to keep doing this one?
Yes, Missy, thank you. You're through this one, okay?
Oh, okay. For students seated in the classroom within less than 3 feet of another student diagnosed with COVID, will have to quarantine for 10 days. Students seated 3 feet or more from another student diagnosed with COVID do not need to quarantine as long as they were asymptomatic and masks were in use in the classroom. This is from the CDC. Students, so for the 3 feet, that's in the classroom. Moving to the bus, the cafeteria, we go back to the 6 feet, and it has to be for 15 minutes or more. That's our direct contact definition for anywhere outside of that classroom. And they will quarantine for 10 days. Adults in close contact to a COVID positive person for more than 15 minutes within 6 feet must quarantine for 10 days, of course, unless vaccinated.
Okay, so good. Thank you, Missy, so much. And what we are going to be offering is in partnership with ELC, we are going to be doing voluntary COVID screening and having this available at the schools. And right now, their focus is for K-6, but they think that we will actually be able to offer this from K-12. And only students that have a parent that have a consent form on file will participate in this program. So we're looking forward to actually launching this testing program with our communities. Additionally, we will be sharing a calendar of vaccine clinics as we partner with the Norwalk Community Health Center, and having these vaccine clinics be convenient for our staff and for our students, and putting that calendar out fairly soon. Ralph? Now, health guidance in sport. So the CIAC policy will follow the current executive order 13A, which means that while indoors, everyone must wear masks regardless of vaccination status. And we are following the CIAC policy, which encourages vaccination in student athletes. Spectators are going to be allowed unless circumstances change, but indoor spectators are limited to 2 per athlete just to reduce density, and they also must wear masks while indoors. And now I'm going to turn it over to Assistant Superintendent of Schools, Robert Pennington.
Thank you, Sandra. So one of the areas last year we had at recess, we were cohorting. This year we will have whole grade level recess. It's permitted as long as it's outdoors. And field trips will also be permitted with students and staff following the masking, social distancing, and hand washing protocols that Ms. Feo has talked about. Right. And now I'm going to turn it over to Assistant Superintendent of Digital Learning, Ralph.
Thanks, Rob. So everybody, I just want to take a moment to briefly review scenarios for students that go into quarantine and how learning will look like for them. So if we do have a student or a group of students that are assigned to a specific teacher that are going to be quarantined, they will be put into a virtual model with a fully remote teacher, and they'll work synchronously and asynchronously throughout the day until their quarantine period ends. The regular classroom teacher will provide guidance to that remote teacher to make sure that we keep current with what's going on in their classroom. If a teacher is actually quarantined, if they are okay to work, they will work remotely with another teacher or a proctor in the classroom, working with the students, a substitute in a sense. Working with the students at that time. If they are not okay, then they will treat this as typically as being sick for those periods of days. And then if a complete class is quarantined, we will look at actually offering that as a fully remote model as long as the teacher is able to work in that case. And Mr. Pennington, I will pass this back to you.
So we know that based on parent responses that social emotional learning is a really important topic this year. And we have some students who have not been in school for 16 months. And so therefore we are making a huge effort as a district to support the social emotional learning of our students. We will have daily instruction in K through 12. We will also have tiered support from our counselors and social workers and psychologists. And each school is refining their social emotional support plan and daily priorities tailored to their students. And principals will communicate the school plans to families next week. In terms of special education, all specialized instruction and related services will be provided in person. In terms of PPT meetings, parents will have the option of meeting virtually or in person. And as we've already heard, some of those to come in for in person, we would have vaccination or proof of testing. We will also have additional supports for students who need supplemental before and after school support programs. One of the areas are for medically complex students and students with vulnerable family members. So if doctors believe if doctors believe that students are unable to physically attend school, they can consult with their school administration and nurse about homebound instruction. This is a Connecticut state law. In elementary school, it's 5 hours of instruction a week. In middle and high school, it's 10 hours of instruction a week. And students with vulnerable family members, we are with medical complications or immunocompromised family members, doctor believes they are severely at risk. They can also consult with their school administration and nurse about at-home learning. And now I'm going to pass it off to Brenda Wilcox-Williams.
Back to me. One of the things that we wanted to make sure that families had was the process when you do have a question or a concern. And this is about not just COVID, but about anything that may come along over the course of the school year. Really, your child's teacher is always your point of first contact. So please feel free to email or call that teacher during school hours and leave a message with your name and your phone number and your child's name, and also let the teacher know what time you can be reached so they can get back to you at a time when you can best connect with them. If your issue or concern is not resolved in the discussion with the teacher, then you can go ahead and contact your assistant principal or your curriculum and instruction site director at our elementary schools. If you need to go to the next level, then you may contact your school principal with your concerns to get those resolved. And the principal, if necessary, will direct you to the appropriate staff here at the district office in central office at City Hall. As a final step, if necessary, decisions that are made at the district office can be appealed in writing to the superintendent and ultimately to the Board of Ed. So we just wanted to put that out there as the most effective way to resolve issues that crop up in your schools throughout the course of the year. And then we do have some other contact information here, and we will make these all available on our new website because we do have some general information and support people available to you to help you get through the year as well. For general inquiries, you can feel free to email familycenter@norwalkps.org. We will be opening later this fall the Norwalk Public Schools Family Center as a central hub of information for parent-facing district services. And we're really looking forward to having that as a source of information for everything from registration to bus information, bus questions, food service. It will all be in one place, and I think it will make it a lot easier for families to access the information that they need. We'll be able to talk to you about choice programs, magnet lotteries, and a whole bunch more in one place. You can also contact our MLL Welcome Center, our Multilingual Learner Welcome Center at norwalkps.org. We will provide the contact information on the website for our bilingual special education ombudsperson. And then we will have, again, a technology help desk available to you that can provide information if a Chromebook is not working, or if you or your student are unable to access something and need some technology support. Ralph's team will have experts in place to help you through that. So with that, Alex, I think back to you for the Q&A.
Thank you. So we hope that this gives you an insight in terms of the work ahead, those that need additional support, especially with students that need special accommodations. Please make sure to reach out to your school buildings, and they will support you in initiating the process. Just note that a lot of these decisions were made based on state legislation in part, and also orders set by the governor. And with the positivity rate right now in Norwalk, our mayor has also issued an expectation that masks need to be worn in schools as well as all of the governmental offices. So We are fulfilling and staying in alignment, working in collaboration with our commissioner, our governor, senator, and mayor to ensure the safety and well-being of all of our students and families. As you probably heard in the governor's address, there have been some school systems that have opened up with a no mask structure, and the positivity rate has soared, having over 20,000 students in quarantine within the first week of school. We did an incredible job last year ensuring a safe return to school and mitigated a lot of the potential challenges that would have come about if we didn't have the safety precautions that we had in place. So we want to continue to take what we've learned from last year. We are in a much better place this year, given what we've learned, and take those learning experiences to apply to this year so that we can have a successful year and that we can provide our students the opportunity to be in person as much as possible. I'm going to turn it over now to Brenda so that we can go through some of the questions that you still have pending after the presentation, but we'll give you a minute or so that you can start populating questions that you might have.
Okay, so we do have, while others are populating questions, we do have some already that we can get started with. Some of them I know were already answered as our team went through the presentation. But we do have a question here as to whether we know if we have any information about whether, at what point the mask mandate, or what would the criteria be for the mask mandate being revisited.
So I can help with, oh, go ahead, Alex.
Go ahead, Sandra.
So I can help with that. So as of now, you know, the state has, like the superintendent said, the state has come out with guidance. The mayor has come out with guidance and mandates, and we will always consult with our local health department and take into consideration the transmission rates in Norwalk as we make decisions around masking. Right now, there is very little wiggle room because the mandate is that we wear masks indoors and within school buildings. So it is revisited when there are changes in the guidance that the state puts out and changes in the city transmission rate, whether we can loosen up mask wearing or whether we have to tighten up mask wearing. So in essence, we really just work with our city to make that determination.
Thank you, Sandra. We have a non-COVID question, and we welcome those as well. So please feel free to ask those. And Sandra, this is probably over to you as well. When will bus schedules be available?
The 27th.
Okay, so those will be published on our website on August 27th. So please look for them there, and we'll make them available on that day. Okay, here's another question, Sandra, probably your way as well. Do the ventilation protocols mean that schools will be unair conditioned in early fall? Can you address that a little bit?
Well, the air conditioner has been running even with us having windows cracked. So if, you know, that I don't foresee that impacting if we need the air conditioner running if it's warm outside. The ventilation was, those protocols were followed even through summer school and in places where the air conditioner was running at the same time.
And even in the winter, I'm just going to piggyback. And in the winter, we set up structures to open up the airflow and followed CDC guidelines in terms of managing our ventilation system to ensure that we had continuous outdoor airflow into our schools to ensure that we were purifying the air. But also with the MER 13 filters, it allowed us to filter the air in a way that would reduce the amount of spread wherever possible.
Thank you, Superintendent.
We have another question that asks a little bit more about, for a little bit more clarity on the 3 feet distancing and in what circumstances we may need to deviate from that.
So when feasible means that we will do everything in our plans and within our control to maintain the 3 feet. But there are younger children that will play with one another, and we will not interrupt that play per se, as they are outdoors. And also, there are older students that will come in contact with one another that may actually come closer than the 3 feet. So the when feasible is also meant for us to not exclude children from school to maintain the 3 feet. So it's better for us to actually do everything possible to manage the distance, but have everybody in one classroom with a teacher, back to the model that we know is the most effective model, than for us to begin to exclude children or go to a hybrid model because of the distancing requirements.
Also, because we have the mandate of utilizing the masks, even though there will be circumstances that will come in closer proximity, the mask as a layer of protection to avoid transmission. And I don't know if Teresa or Dr. Weinberg would like to add anything to that.
Yeah,
Teresa,
I think that I think what Sandra and Dr. Estrella are talking about is that the different layers of mitigation strategies. And so important that all of those strategies are in place whenever possible, and that if one or another has to be taken away, or to Sandra's point about occasionally people coming closer than 3 feet, the importance of those other mitigation measures, the good ventilation and the proper mask wearing and the hand hygiene are really important as well. So it's a combination of several factors. Ideally, they're all in place as at 100%, but we know that that's not always possible. So keeping as many in place as possible will really helpful.
And to add to that, it is very clear that because this is a respiratorily mitigated process, the masks are the mitigating most important piece.
Great, thank you, everyone. I have a question actually that will probably go to Ralph, and if you could talk a little bit about the availability of laptops at the beginning of the year, especially in regards to so that they're available for class quarantines if we have any.
Yeah, so in general, as a district, we've now decided to go to a one-to-one model permanently. So even outside of COVID, we will be working on a one-to-one model. That being said, we did collect a lot of the machines. We cleaned them up over the summer. Students will be issued them over the first few days of school, and we will be back to having them used on a regular basis. If they are quarantined, they will then have a machine to work with at home.
There's a question about whether or not social gatherings refers to PTA and SGC sponsored or community events. So if you could elaborate on that a little bit.
We are going to be having some events that are allowed at the schools after the end of the school day when there are no longer students in the schools. And these gatherings that could involve like PTA meetings or SGC meetings are possible. However, we do also want to make the virtual meetings available for those folks that may want to join a meeting, but perhaps can't because of, vaccination status or testing status. Because for those people that will be coming into the school regularly, you will also be having to provide either the negative test or provide proof of vaccination. So as we understand that some families may not want to do that, we want to be able to offer a virtual option also. Superintendent, do you want to add to that?
No, I think you addressed all the factors, and we addressed the athletic component, which it will be an after-school activity as well, and that would also be an opportunity for potential gathering following the protocols. But as you articulated, this is something, as you articulated this before, this is something we will be monitoring closely as we continue to track the positivity rate within the community and across the state.
And just as a follow-up on that, there's a question about whether PTOs will be allowed to plan outdoor events.
So my take on it right now is that outdoors are okay. We are going to put in place other mitigation strategies to make sure that we are reducing the spread. So outdoors have been okay. Obviously, each principal will bring to us the plan from their PTO for us to just make sure that we are supporting the schools, providing wipes or whatever it is to make sure that we're keeping people safe. So the outdoor events for the fall, many of you guys have been given the okay to move forward with certain event. The indoor events are the ones that we are discouraging right now and putting on hold. Dr. Weinberger, did you want to add anything to that? I see you leaning forward. No? Okay.
No, that's good. That's good.
Thank you.
Alex, we have a few questions. Perhaps the superintendent may want to review a little bit about the information that we learned from the governor today about the vaccine requirement for employees that's going to be put into place.
So the requirement from the governor is that all employees are encouraged to be vaccinated, and in circumstances because of either a religious or medical exemption, in those situations, they would have to engage in weekly PCR testing. So we are working right now with the HR department to organize a structure where if anyone falls under the either medical or religious exception, they will have the opportunity to submit their PCR weekly testing. As Ms. Fayos articulated earlier, we are going to have the ability for personnel to test within some of the local facilities that we will be setting up with one of our partners, but they're not obligated to go to any of these sites. They can engage in testing personally wherever they wish to do so, but they will be required to test on a weekly basis.
May I add to that? Go ahead, Alex. I apologize.
I was just going to say, just based on some of the statistics presented at the governor's release, all the data is showing that those that are not vaccinated are 10 times more likely to wind up in the ICU than those that are vaccinated. And the data is quite striking. So I think that it's evident that there is a benefit in getting the vaccine to avoid major illness. We have a very interesting situation right now because we have children under 12 that can be vaccinated, and I think that once our children under 12 have the ability to get the vaccine, we will have to revisit some of the parameters that we have set forward, because our hope is that the vaccination rates continue to increase within the district. I'm really encouraged at the number of our students that have been. I think we're over 70% of our students that qualify for the vaccine have obtained at least the first dose. We had a really big concerted effort at the end of the school year when the 15 and above, 12 and above were eligible to get vaccinated, to really support our families by setting vaccination sites throughout the district and help in the facilitation of that. And we will continue, like Sandra articulated before, to do so. And we will offer the same opportunities for our staff as well.
And the only thing I wanted to add is that currently we are offering testing already, and it's being done at Brian McMahon on Saturdays in the morning and then on Monday evenings. And we will continue that exact schedule through September. And then we will have a link on our website with testing sites that are available that you can seek out on your own, and also the vaccination calendar.
And for the staff members who are on here, we will have more specific information out to you via email, either tomorrow or Monday. So look for that as well.
If I could just add to that, the questions about testing, we are advocating to bring more resources into the community for large community-based testing, as well as to work with Norwalk Public Schools and the State Department of Public Health to bring more testing to schools as well, as Sandra mentioned. And then also just to reiterate the importance of vaccination, just encouraging folks. I'm so happy that the district is setting up vaccine clinics, but there are also others going on right now in the community. And if you're interested in being vaccinated as soon as tomorrow, you can go to www.norwalkct.org/vaccine to see information on mobile clinics that are happening around the community right now. And the vaccine is free. And most locations, you do not need an appointment. The city's website will continue to update as there are more testing options available as well. So keep an eye on those areas.
Thank you, Teresa. We have a question about whether or not parents will get notified again this year if there's a confirmed case in their child's classroom.
We will continue those notifications as we did last year. Sorry, Sandra, I jumped in. We will continue to do follow the same protocols and notification as we did in the previous year.
Okay. We have a question about special education services and how those will be addressed if a child is required to quarantine.
Robert?
So we will have a team that will be supporting if a child goes on quarantine so that they receive their services. And then the other option is when they return, they can be made up services, but we do have supports to support them while they are quarantined.
And Mr. Pennington, while we have you, we do have a couple of questions regarding just the process for students who are immunocompromised and how parents go about requesting those exemptions. I know you covered it in detail a little bit earlier, but if you could just answer in terms of what the process is for requesting those and the forms that need to be completed.
Absolutely. So there is a checklist that when the family reaches out to the school, that they'll be provided, and we can actually post it with this presentation and information. But it's a checklist that there's connection with their physician, and then there is a couple documentations that need to be signed, and then they can be sent back, and our team will look at those and make a determination.
And to just piggyback on another question that we had there, you mentioned posting these online. We will post the presentation online as well. And there will be a school opening handbook that's online next week as well that will give you all the details that we're talking about here today as well. So we have a question about outdoor classrooms. Since we know outdoors is a safer place to be, are we able to encourage holding classes outdoors?
So one of the big things that we did prior to the end of the school year was the initiation of creating outdoor classroom spaces in preparation for the potential possibility that we would be in the current circumstances that we're in. So we are highly encouraging opportunities for students to engage in outdoor learning throughout the year. We have worked with some SGCs and PTAs that have made requests in volunteering and collaborating and designing outdoor spaces to do so. And we can provide a list of some of the outdoor spaces attached to this document at a later date. But this has been in an ongoing effort throughout the district to create these learning spaces. And again, we highly encourage them in the upcoming school year.
We have a parent question about what percentage of staff is vaccinated or unvaccinated, and will we be able to share school-specific data?
We are still collecting that data as we speak because we were waiting to hear from our governor. what the final expectations were going to be. Now that we have full clarity today as to the path forward, we will start the collection of that data, and we have to further determine what could be made public and what cannot. Once we have clarity around that, then we will make available the information requested.
Okay. Question probably for Sandra. Will classrooms have to be split in order to maintain the 3 feet of distancing?
Crossing our fingers as of today, no. There are a couple of people that are sort of right near the capacity, the full capacity. But before we would go that route, we would look at furniture arrangement, even possibly other furniture, to make sure that we're keeping classrooms intact. So we want to keep classrooms intact as much as possible. So we would have to exhaust all possibilities before we split a class.
We have a question about asking whether all schools have the MERV filters.
Yes, all schools have a filter, and all schools have filters in their classrooms.
And the MERV 13s were, the previous filters were replaced with MERV 13s last year.
Okay. Is it possible that the district will end up in full remote if COVID cases rise like last year?
It depends on how the governor and commissioner decide to move the work forward. Right now, there is legislation that does not allow for remote instruction until 22-23. So unless the executive order, as well as the legislation that was passed this past year shifts, we still don't have clarity in terms of how we would move forward.
Okay. We have a question about the change in elementary school start times versus last year. Rob, you want to take that?
Sure. Yes, last year we had a 15-minute early dismissal. This year we returned to our normal scheduled times. They are on the Norwalk Public Schools website as well. And I can post a link to all of the schools into the chat box for anyone who needs it, but it is right on the Norwalk Public Schools website, and it just reinstated those 15 minutes this year that we did not have in place last year.
Sandra, can you talk a little bit more about lunch, especially when it comes to the high school students who were limited to 2 per table last year? How will they be getting their lunch, and how will they be allowed to sit this year?
Sure. So Kevin McGinn from Chartwells has actually met with school leaders at both high schools to come up with plans for students all to be able to either do a grab and go lunch where they go to a designated area. We're still utilizing all the creative spaces that we had come up with last year. And then the cafeteria is back on as long as we maintain that 6 feet distancing. I actually feel pretty confident that we've come up with plans for students to be able to eat comfortably, and actually plans that force us to be a little bit more creative about where students are eating and giving them a little bit more autonomy as to where they want to sit with their friends. So we have designed those plans, and I'm actually hoping to finalize them, and along with the other COVID resources that we can make public, that we can make that document public also.
Okay. We have a question about safety drills, lockdown drills. Can they be suspended or changed to ensure that students can be distanced for health and safety?
We're actually going to resume some of the safety drills that we had before, and obviously making sure that we're putting in mitigation strategies to keep students safe. So the masking is something that we know works for students and keeps students safe. So we will be working with each school principal along with our school preparedness coordinator to make sure that we could do these drills in a safe way. There will be distancing that will be required in some of these drills, and then others that we will have to follow the state guidance around. But we are looking to reinstate many of these drills because it's been a whole year of us sort of being very lenient with these drills, and safety is our top priority this year, including our emergency preparedness and making sure that students and staff know what they should do in case of an emergency.
Can we, will students have mask breaks this year, and how are we going to enforce mask wearing?
Well, you know, the strange thing about last year is that we had really thought about how we were going to enforce mask wearing, and students actually did a really good job at keeping on their masks. We do have scheduled mask breaks. That's the same for this year. And teachers have become really good about how is it that they organize that time and organize snack to provide also students with that mask break. So we've had a year of practice for mask breaks, and we'll keep some of those processes with us this year. But as far as the enforcing of mask wearing, I have been very impressed with our students, even the little ones and even our teenagers, with how well they are doing with keeping their masks on. So we don't anticipate that that's going to be problematic, but we will work with each individual school as these needs arise about how to incentivize mask wearing, making sure that they are adhering to the protocols.
What will happen with the music programs this year, especially choir and indoor musical instruments?
So we actually fall back on the guidance that was in place for the spring. So there was guidance about making sure that we're running some of these music programs safely, and there's still others that have been limited. And we can actually make that also part of our parent handbook now that we have the guidance from the state to be able to share with parents as to what music looks like this year.
Okay.
That just came out today in our defense, but we still have the spring guidance from last year.
And we have a question about school open houses and whether they will take place this year in person or virtually like last year.
That question actually came up with our principals earlier today. So we're encouraging virtual open houses when possible. And if we could do open houses in small clusters staggered, that we're willing to support that. Obviously, it's after school with all the mitigation strategies in place. And some schools will choose to do them virtually, and some schools for like NECC is choosing to actually have some parents come in. So we're working with each school to make sure that they're comfortable devising a plan and then carrying out the plan that makes the best sense for their community and for that age group and those parents.
And Brenda, just to be respectful of time, we're 5 minutes past the time. So let's take another 2 questions, and the others that might not have been addressed, we can address in the opening handbook that will be distributed at some point towards the end of next week to all families.
Okay, so I have a question that I think applies to everybody. Obviously, we know that the state is requiring that there's no remote learning this year. There's a question about whether or not there'll be virtual learning on snow days.
At this time, the guidance is that there is no virtual learning during snow days.
Okay. All right, very good. And then who will develop the asynchronous lessons for the quarantine students? Curriculum question.
So the sub or the long-term sub assigned to the school will be working in collaboration with the teachers, and the sub would be responsible in designing the lesson. And we have some online tools that we will be utilizing to complement that work during the quarantine. And Rob, I don't know if you want to add anything to that.
I think you hit the nail on the head, just that they're going to be in collaboration. The substitute teacher will be in collaboration with the classroom teacher to provide support and instruction.
Dr. Estrella, also the instructional coaches for digital learning will work with those staff members to make sure that they're supported as well.
Okay, and then just one final, we will put this on the website. As we mentioned, this was available as live interpretation in both Spanish and Haitian Creole, and that will also be available on our YouTube channel, and the materials will be translated and available there as well. So, Superintendent, over to you to close.
Thank you. So I want to thank everyone this evening for joining us. I know that COVID has not been an easy process for any of us, and I know people are exhausted. I think that makes it more challenging this year for us as we continue to immerse our path forward in this new year. But I see light at the end of the tunnel. We've learned so much. And from that learning experience, we will continue to strengthen our practices within our schools. There's no better place for our children to learn than within our school buildings with our teachers alongside the different providers. So we're going to make every effort possible to ensure that not only our kids have a great reopening, but that we continue to monitor and mitigate any situation that will create circumstances that will limit their ability to be in schools. We will work with our health providers as well as our health experts and scientists to make the best decisions necessary to ensure that our students are safe while they continue to learn and engage and develop, while also carefully monitoring and instituting a lot of the great things that bring joy to our schools. Like sports, I know is a big deal, and we've been monitoring that carefully, working with our athletic directors. As you know, middle school sports is something that's going to be new this year. And this morning I had a great conversation with the high school athletic directors that have been helping us plan this work. So there's a lot of great promise in the year ahead. At the same time, there are challenges that within any year we will continue to have to face to ensure that our students continue to learn in the most productive environment. Just know that we're here to support you in anything that you need to make that possible. And onward and upward we will go to ensure that our students have an amazing academic school year. I'm really excited about what's to come. And we will continue to monitor this pandemic so that we don't limit the opportunities for our students as a result of some of the challenges that it presents. Again, thank you for allowing me to be your superintendent. It's been a pleasure this first year, and I'm looking forward to a strong second year, despite anything that comes our way. I'm confident we have the right team in place to ensure that your kids have the adequate education they need in a very safe and productive environment. With that, I am wishing you all an amazing evening and rest of your summer before we start. I don't know if our chair would like to say a few words before we conclude the evening. Mr. Hostin? I don't know. Well, with that, thank you and have a good evening, everyone. Bye-bye.